Yeah, Joanna, now that there's a confirmed case of Ebola virus in New York State, some residents are worried the virus will make its way here to Buffalo. Healthcare professionals maintain we've been ready to handle a potential patient.
But I don't think most people should be concerned. If you're going to be concerned about anything, I'd recommend that you get a flu shot, because 60,000 Americans died from the flu last year.
County officials not hitting the panic button now that a confirmed case of Ebola is in New York State.
We are prepared, as we announced earlier this week.
All hospitals in Buffalo have performed mock Ebola drills, have personal protective equipment and isolation rooms ready should an Ebola patient walk through the emergency room doors.
Our healthcare system is prepared to identify, isolate, diagnose, and perform the initial management if somebody is diagnosed with Ebola until they can get into a higher level of care.
But a disease that has many people alarmed and scared has only been contracted by healthcare workers in the United States.
Most common way in which transmission is going to occur is going to be in people who are healthcare workers who are closely exposed to very ill patients with Ebola.
Doctors don't want to scare the public, but rather provide the facts of the disease.
Remember, in order to get infected with Ebola, your body fluids have to come in contact with somebody's body fluids who has an Ebola infection. And somebody who has an Ebola infection who's contagious, they're going to be really sick. So they're not going to be going grocery shopping or shopping in the mall or going to any community events. They're going to be home, or hopefully they'll be going to the emergency department where they can get the appropriate care.
Again, health officials in Erie County stress this recent case of Ebola in New York City poses little to no threat here locally. But should a case arise, doctors say we are ready to immediately kick our Ebola protocols in gear.